So what would you say to a physician who is uncomfortable with using telehealth?
I think there's never been a better time to try it. Because the regulations have been relaxed, you're able to use various forms of technology. Um, you can start with just phone calls and phone visits if that's where you feel more comfortable, or have the capability of using phone, Zoom, FaceTime, Skype, many different venues. In addition to, there's quite a few, of course, telehealth platforms that actually fully integrate with the electronic health record. So there's lots of options, but I think patients right now are also very understanding and accepting. If you have the technology, it doesn't work perfectly. If there's certain things that the provider says, I wanted to connect with you, I wanted to provide and check in and see how you're doing, and do as much as possible in this visit, but keeping in mind there may be some things I'm going to need you to come into the office for after after COVID subsides, or some tests that I may need you to go get so I can get the results. And I think patients, they really want the connection. And I think to be able to have the connection with the provider, be able to share what's wrong, and get some response real time, I think is so important. And that I really believe that there's never been a better time for them to try it. And whether it's an acute condition or something that's more chronic, I think it's really important to stay connected with your patients. And, as we reopen, we're actually starting to hear from quite a few patients that they're starting to still delay care. They're like, I'll wait a few more months, I'll come in. And we really don't want patients to delay care because we don't know if COVID's going to go away anytime soon. We think this is probably something we're going to be living with to some degree for possibly, 1 year or more. And so we want patients to not push things off. And so I think it's really important for the providers to stay connected with them in any way. And so I think just thinking through that, pick a small segment of your population that you think could benefit from telehealth visits, get started with those patients that you've seen before, the return patient population, and then see how you can kind of branch out and start to use it for new patients or more maybe complicated conditions. So I think it's a great time to get started if you haven't already.